So you need to write this NCLEX exam. So some of you might be knowing about this exam. So this exam basically is for if you want to practice in Australia and US and Canada. So these three countries, any of these countries, if you want to practice there as a nurse, so you need to write this exam and pass. So this is a really easy exam and you can pass from your home country. And once you pass, then you can apply the permanent visa. Okay, so I will go through all these steps you have to take. And Academically is here to help you to complete all these steps. So easily you can migrate from India to Australia. So Academically is a company, education company, and we provide assistance for all healthcare professionals like medical doctors, dentists, pharmacists, nurses, and lab technicians, and optometry, and veterinary doctors, physiotherapists, any healthcare professional. And now they are looking to migrate abroad. So we provide all the assistance and the coaching for you. So easily you can pass exam and you can migrate to your desired countries. So this is myself. I completed my PhD from University of Sydney, Australia. And before that, I did my bachelor's and master's from India in pharmacy. So I have around teaching experience 11 years in India, Malaysia, in Australia, especially the I'm one of the pharmacotherapy experts. So this is some of the faculties for this course for NCLEX for you. So these are what's the opportunities for you in Australia? Why you want to migrate to Australia? Why you have to migrate to Australia? Basically, the first question. So Australia provide 195,000 permanent visa every year, and nursing one of the I can say the top 10 occupation, the highest shortage in Australia. So if you see, this is the latest news published 2 months before. So in the law, like top 10 occupations, even doctors or physiotherapists or dentists or pharmacists, none of them in this list. So in this list, only the nursing professionals only in this list. So around 200,000 nurses needed currently in Australia. So if you just go on a website called seek.com.au, this is a number one job website in Australia. So there is a 12,179 advertisement ongoing. It means one hospital might have 10 vacancies, might be 20 vacancies, so given one advertisement. So, so there is a hundreds of vacancies, thousands of vacancies are available for nurses currently. And every year is going to grow in the need of this, for nursing in Australia around 14%. And the salary around 83,000 Australian dollar per year. So there are some other advantages if you want migrating to Australia, like higher earning potential. That's the thing. And another one is the education is free for you and for your family. And if you have a kids also, so whatever education free in Australia. And healthcare access also free in Australia as compared to like US. So in US you need to buy the insurance for health insurance. There is no universal health coverage in US. In Australia, it is a universal health coverage, so you no need to buy anything. You will, if anything happened to you or your family, government will take care basically. And professional development. So if you want to attend any specific webinar or any workshop, the hospital will pay. So yearly at least 2 times they recommend, so you have to go and upgrade yourself. Work-life balance yearly here is you just need to work 8 hours and 5 days. That's all the time you can give to your family. So easily you can easily can manage here in Australia. A lot of job opportunities in Australia and fastest visa basically for the healthcare professionals, including the nurse. Okay, quality of life is very high as compared to India. So what is the eligibility for this exam for Australia to migrate? So they need 4-year bachelor degree, and you must hold your registration as a nurse. So you must be a registered nurse in the home country and by B.Sc nursing. This is the eligibility to migrate to Australia. So there are some of the steps you need to take. The first step called initial skill assessment, or also we can say document verification. Though this is very, very simple. You just need to provide us your document and we will complete all these steps behalf of you. Okay. So the first step we will complete behalf of you. You just need to provide us your document. Document means the scan copy of document. Okay. What are the documents need? I will cover in the next slide. So, and number two step, basically, you need to write this NCLEX exam. So for this, we will provide you a 3-month coaching live classes from Australia, and then you can pass this exam. Bangalore there is a center, Hyderabad also center, Chennai also is there, Mumbai center. There are several centers in India. So you just go there and to pass this exam. Okay. And then after this, you also need to pass a English test like IELTS, OET, or PTE. Okay, so we also provide the coaching for these. So basically, from 1st of September, the TOEFL, the Australia government removed. The TOEFL is no longer accepted in Australia because my slide is a bit old. So I just corrected here. So for English, the only 3 tests you can give: IELTS, OET, or PTE. Okay. And then after this, then you can start looking a job in Australia. So you will get most likely a lot of jobs offers once you pass these two, and then you can come to in Australia. You can write this OSCE exam, and then you will get a full registration. Okay. So after this, definitely you will get the offer. There is a lot of hundreds of jobs are available. And in this test, basically, they need 7 an IELTS individual or equivalent in the PT. So PT required 65 points, and OET required B band. Okay. So we need basically documents. We need your degree, transcript, work experience if you have any, valid passport, government ID proof, passport size photograph, nursing registration. And importantly, we need basically you have to take a color printout and then notary from a lawyer, and then you have to submit all these documents. And this is the body in Australia, Nursing and Midwifery Board, APRA. Here you have to register yourself as a registered nurse. So basically, in this mostly they will uh, earlier it was 65 questions. Recently now they changed. So minimum questions you will get 75, or maximum it is 150. And the exam time is around 5 hours. So it might, some student, if you are correcting more questions correct, you might receive only 40, 75, and within 2 hours you can finish the exam. If you are giving some wrong answers, and some correct answers, so it might take, they will give you, the system will give you the more questions, and then once you're done, and then system will say that now it's fine. I mean, it's complete your exam. Okay, this is like minimum 2 hour, maximum 5 hours. The minimum questions they will give you 75, or maximum you will receive 150 questions. Okay, and for this exam there is no negative marking, and we will provide you the coaching for 12 week basically, or 3-month coaching for this NCLEX exam. And then you are eligible to apply permanent visa like 189 or 190. These are the work a PR visa, or you also like 491, 494, 482. So all these visa are eligible for the nursing professionals. So these are some of the fees. I think our team will give you the more information if you require. Siva already in your will here. So we also provide a financial loan options we have. So if you have any problem, I mean, if you want, then we can help. So you can pay basically your fees in like 6 months, 9 months, 12 months. This is a no interest rate. So we are not charging any interest. So academically will pay behalf of you all of your interest. So you don't need to pay any interest for the loan. Okay. Here are some of the reviews, and a lot of students from Kerala. So, or if you have any questions, you can ask now. Yes, students, please ask your doubt or any questions. Shiva,
Students, please use your chat box, or or you can also unmute and ask the doubts. Right? എന്ത് ഡൗട്ട്സ് ആണെങ്കിലും നിങ്ങൾ ചോദിക്കുക. ഇപ്പൊ പറഞ്ഞതിൽ ഏതെങ്കിലും ഒരു ഭാഗം ക്ലിയർ ആയിട്ടില്ലെങ്കിലും എന്താണെങ്കിലും നിങ്ങൾക്ക് ചോദിക്കാവുന്നതാണ്. പ്ലീസ് ആസ്ക് മാക്സിമം ഡൗട്ട്സ്. ഈവൻ ഫാക്കൽറ്റീസ്, ടീച്ചേഴ്സ് ഓൾസോ ക്യാൻ ആസ്ക് doubts on the students' behalf. Students, please ask some doubts, because I'm sure that everything won't be clear to you. So നിങ്ങൾക്ക് മനസ്സിലാവാത്ത എന്തെങ്കിലും ഉണ്ടെങ്കിൽ നിങ്ങൾക്ക് ചോദിക്കാവുന്നതാണ്.
Shiva, I would request you can speak with them in Malayalam for 2 to 3 minutes and ask them to raise their questions and clarify.
Yes, yes, yes. സി ഡൗട്ട്സ് എന്തെങ്കിലും ഉണ്ടെങ്കിലും നിങ്ങൾക്ക് ചോദിക്കാവുന്നതാണ്. ഇപ്പൊ എല്ലാം ക്ലിയർ ആയായിരുന്നോ? എന്തെങ്കിലും ഡൗട്ട്സ് ഉണ്ടോ എന്നുള്ളത് നിങ്ങൾക്ക് ചോദിക്കാവുന്നതാണ്. And Dr. Akram, I request you to please guide them about the OSCE examination also once, the final step before they acquire their full-time registration.
okay. So OSCE is basically a clinical exam. So this is mandatory any healthcare professional, whether it is a medical doctor, dentist, pharmacist, nurse. So everyone has to go for this exam is a OSCE. Okay. So this OSCE, like they will give you some cases and you have to find out the problem and give the solutions, kind of thing. This exam is not really very tough. It's a easy exam, I can say. So there is several stations like A, B, C station is there. So station one, you have to go and talk to a patient. Maybe station two, you have to talk to a healthcare professional. Like this. So we will also provide the coaching for this once you pass this part one and NCLEX one.
Okay, and it is mandatory for them to write take both of the examinations before they can start working as a nurse in
No,
Australia,
no, no,
right?
no. I mean, they can start working in after the NCLEX, they will get job, but they will not get the registration. So the employer will give them the job offer, the conditional job offer. Okay, so they have to come Australia, on work visa because employer already gave the job, but they need to pass this exam. So they can start working, and then because after part one, they will get the provisional registration, not the full registration. Full registration they will get once they pass this exam OSCE.
Okay. Students, if you have any doubts, please ask. Or ഇപ്പോൾ ഏതെങ്കിലും ഒരു സ്ലൈഡ് അല്ലെങ്കിൽ ഏതെങ്കിലും ഒരു പാർട്ട് ഈ പ്രോസസ്സിന്റെ ഏതെങ്കിലും ഒരു ഭാഗം ക്ലിയർ ആയില്ലെങ്കിൽ നിങ്ങൾക്ക് അത് ചോദിക്കാവുന്നതാണ്. യു ക്യാൻ അൺമ്യൂട്ട് ആൻഡ് ആസ്ക് ആസ് വെൽ. See, there are a lot of countries, apart from Australia, where you have this option to write the examination and migrate. നിങ്ങൾക്ക് അങ്ങനത്തെ options വരുന്നതുണ്ട്. So why we are specifically talking about Australia now? If you were there, came to your college last time, I've also mentioned there. See, they are not asking for any experience at the moment. Right, which means നിങ്ങൾക്ക് നിങ്ങളുടെ കോഴ്സ് കഴിഞ്ഞ ഉടനെ തന്നെ ഈ ഒരു പ്രോസസ്സ് ഫോളോ ചെയ്തിട്ട് യു ക്യാൻ മേക്ക് യുവർ സെൽഫ് ആൻ ഓപ്പർച്യൂണിറ്റി ടു സ്റ്റാർട്ട് വർക്കിംഗ് ആസ് എ രജിസ്റ്റേർഡ് നഴ്സ് ഇൻ ഓസ്ട്രേലിയ. അതിൽ നിങ്ങൾക്ക് വരുന്ന എക്സാമിനേഷൻസും കാര്യങ്ങളും ഒക്കെ യു ക്യാൻ റൈറ്റ് ഫ്രം യുവർ ഹോം ടൗൺ ഇറ്റ് സെൽഫ്. നമ്മുടെ നാട്ടിൽ നിന്ന് തന്നെ എഴുതിയിട്ട് നിങ്ങൾക്ക് പോകാൻ പറ്റുന്ന രീതിയിലാണ് കാര്യങ്ങൾ വരുന്നത്. Right, where your salary, your work-life balance, your other benefits is anyways better than what it is provided in our അതിനെ പറ്റിയിട്ടുള്ളത് നിങ്ങൾക്ക് ചോദിക്കാവുന്നതാണ്. Since we have Dr. Akram Ahmad here, so നിങ്ങൾക്ക് chat boxൽ ചോദിക്കാം. There is no issue with that, right? So please ask maximum doubts. നിങ്ങളുടെ doubts ചോദിച്ചാലേ അത് ക്ലിയർ ആവത്തുള്ളൂ. അതുകൊണ്ടാണ്.
Shiva, I think are they working like in the hospital as of now?
Ma'am had told me that they were having some sort of emergency program due to which all of the students were not able to attend. This was one of the reasons what ma'am told me.
No,
Right?
so those
So-
who are like here, they are not asking questions. So what I'm assuming is that they are in the hospital as of now also. They are not.
I don't think so.
Questions.
Guys, can I get few responses in the chat box? എന്തെങ്കിലും റെസ്പോണ്ട് ചെയ്യാവോ നിങ്ങൾക്ക്? നിങ്ങൾ എന്തെങ്കിലും റെസ്പോൺസ് തരാമോ? ലൈക്ക് ഇപ്പൊ എല്ലാം ക്ലിയർ ആയായിരുന്നോ? നിങ്ങൾക്ക് എല്ലാം ക്ലിയർ ആയിട്ട് കേൾക്കാൻ പറ്റിയില്ലയോ? എന്താണെങ്കിലും ഒന്ന് പറയാവോ ചാറ്റ് ബോക്സിൽ? It was clear, right? Okay, what about others? Everything was clear. Okay, clear.
Not a problem. Then what I would request sir to move on, because it is
Yes.
in Australia.
Yes. അതുകൊണ്ടായിരുന്നു.
Their questions, you may please move on, please. You
Yes.
Yeah.
Yeah, so what it is, students, is that it's already around 12 o'clock in Australia now, right? So sir has made up his time schedule clear to just take the session for you. So due to which, if you don't have any doubts, we can ask sir to move on. Thank you so much, Dr. Akram Ahmad, for giving.
Thank you, sir. Thank you, Amin. Bye.
Thank
Good
you,
night,
sir.
Nidra.
Bye.
Thank you, sir.
Good night, sir. Good night.
Good night.
സോ ഇപ്പോ ഇവിടെ ഒരു ഫീഡ്ബാക്ക് ഫോം നമ്മൾ ചാറ്റ് ബോക്സിൽ കൊടുത്തിട്ടുണ്ട്. സോ നിങ്ങൾ ഇപ്പോ ഡൗട്ട് ചോദിക്കാൻ പറ്റാത്ത ഒരു സിനാരിയോയിലാണ് എന്നുണ്ടെങ്കിൽ വാട്ട് യു ക്യാൻ ഡു ഇസ് ദാറ്റ് ഫിൽ അപ്പ് ദോസ് ഫീഡ്ബാക്ക് ഫോം. ക്വസ്റ്റ്യൻ എന്താണെങ്കിലും അതിൽ ചോദിക്കാവുന്നതാണ്. ഓക്കെ, സോ ദാറ്റ് വി ക്യാൻ ഗിവ് യു എ ഗൈഡൻസ് ഓൺ എൻ ഇൻഡിവിജ്വൽ ബേസിസ്. So student, please fill the feedback form. And if you have any doubts, still me and Amin are here in the meeting. So നിങ്ങൾക്ക് doubts എന്തെങ്കിലും ഉണ്ടെന്നുണ്ടെങ്കിൽ still you can ask. If you don't have any doubt, നിങ്ങൾക്ക് feedback form fill ചെയ്തതിനു ശേഷം you can leave the meeting. There is no issue with that. Yes, ma'am.
Ma'am is asking in the chat box that whether they have to fill in the form right now or they can fill in later. So ma'am, it's up to you. You can circulate later also and ask them to fill in that form. If their questions are unanswered, they can mention their questions also. So we will call them and help them in addressing their questions, ma'am. Thank you, ma'am. I think, Siva, we can wrap up now because they don't have any questions and they can fill in that feedback form, mention their questions if any questions arises later on.